No, ma'am.
Yes, sir.
Good afternoon.
Afternoon.
Sorry I'm late to your appointment. I was backed up in the clinic all day, but I'm here for you now. I'm just gonna shut the door and wash my hands. Um, could I have your name?
Hi, Leah Arrington,
When was your birthday?
November 2021,
And how old are you?
31,
31. And what is your race?
Asian.
Asian. And what do you identify as? Female?
Yes.
Okay, good. So, what brings you to the office today?
Having some headache, and it's been 2 weeks already.
2 weeks with a headache?
Yes.
Okay. So, sorry to hear that. So we're here to take a look at why you're here today, of course, and then we're going to do a head-to-toe physical assessment, which involves a lot of questions. And then later on, I'll do an assessment of your head and then go into your toes, which involves me asking you a lot of questions. Some of them are personal, and me putting my hands on you to do a thorough assessment. You okay with this?
Yes.
Okay, if any time you feel uncomfortable, just ask me to stop.
Okay.
So, said you're here with the headaches. When did they start?
2 weeks ago.
2 weeks ago. And palliative factors, anything that makes your headaches better.
Yeah, we take Tylenol.
Tylenol helps
Yes.
it. And what about provocative factors? Anything that makes it worse?
Yeah, loud noise and a lack of sleep.
No sleep and loud noises. Okay.
Yeah.
Can you describe the pain in your head to me? Is it sharp, dull,
Dull.
pain, and finger where it hurts?
It's here on my right side.
Oh, okay, right side headache. And does the pain radiate anywhere? Does it go down to your cheek or jaw, shoulder?
No, it just
Localizes in the right side of your head. And can you rate your pain 0 to 10 right now? 10 is the worst pain imaginable.
It's 0 for me.
0? Good. And when has it been most severe? 1 to 10.
I think 6 or 7.
6 or 7. And how long does the headaches last if you start having one?
Yeah, if I didn't take a pain reliever, it lasts like 1 to 2 hours. And it come and goes, you know.
Okay. Well, I hope we can get you some help for that today.
Thank you.
So I'm going to go ahead and move on to the medical history portion of this exam, if that's okay.
Mm-hmm.
So do you have any diagnosed medical problems?
No.
Nothing whatsoever, huh?
No.
Do you have any chronic diseases?
No.
No chronic diseases either. Have you ever had any infectious diseases?
None.
What about psychiatric mental illness problems?
None.
Well, in that case, if there were any diagnosis, we would want to know what you were diagnosed with, at what year, what age you were, any treatments, medication, or any hospitalizations. Speaking of which, have you ever had to be hospitalized?
Yeah, when I give birth.
Okay, just for childbirth?
Yes.
How many times?
2 times.
How many children do you have?
2.
How many times have you been pregnant?
2.
Any abortions?
No.
Miscarriages?
No.
Okay. When was your last menstrual period?
It's been 2 years already.
2 years.
Almost 2 years. Yeah.
Oh. Do you use any birth control?
No.
How do you and your husband, well, are you married?
Yes.
Yeah. What do you do to protect yourself from sexually transmitted infections?
Oh, nothing. Because just me and my husband.
Just your sexual partner is just your husband?
Yes.
Okay. Do you have any future pregnancy plans?
No.
No. Have you had any surgeries other than the cesarean section?
No.
No. Do you have any drug allergies?
No.
So you never had to be hospitalized other than your pregnancy, right?
Yes.
What are your vaccination status?
I have it already. Oh,
It's up to date.
yeah. Last year.
Okay. Do you take any prescription medication?
No.
And you're not allergic to any drugs, right?
No.
Okay, let's move on to your family history. So this is pertaining to your mother. Is she alive?
Yes.
How old is she?
67 years old.
Okay. And does she have any medical problems?
Yes. She, she's diabetic, high blood pressure, high cholesterol, and she's, she's having a heart enlargement also.
Hmm. Okay. How about dad? Is he still alive?
Yes.
How old is he?
76 years old.
And what, if any, medical problems does he have?
Yeah, same with him, high blood, diabetes,
Mhm.
cholesterol, and
Mhm.
he had stroke also.
He had a stroke?
Yes.
Oh, okay. And so this is your maternal grandparents, your mom's mom and dad. Are they alive?
No,
Do you know the ages that they passed?
no idea.
Your mom's mom and dad, do they have any diagnosed medical problems?
Um,
Paternal grandparents, your dad's mom and dad, are they still alive?
no, see,
Any idea on the age that they passed away?
no idea.
Any diagnosed medical problems?
I don't know.
No. Are you the only child?
No, I have two sisters and five brothers.
Sisters, what are their ages?
50 years old and 42 years old. Oh
Mm-hmm.
no, 42 years old. And
Mm-hmm. Any diagnosed medical problems for your sisters?
yeah, they both have a heart enlargement, same with my mom.
I see. And your brothers? Said you have 5 brothers?
Yes.
What is the ages?
48, 46, 44, 2 age gap.
2 years?
2 years age gap, yes.
And your brothers, do they have any medical problems?
No.
They're alive and well.
Yes.
And you have 2 children, right?
Yes.
What are their ages?
4 years old and 8 months.
Okay. Any problems with them medical wise?
No.
Okay, very good. So this is going to be the review of systems of your family. Whenever I ask a question, this is pertaining to everyone in your family, immediate family. Okay.
Okay.
Anybody have any problems with their eyes? Any blindness,
No.
cataracts,
No.
blurred vision?
No, not at all.
No. Any problems with their nose, smell?
No.
Any broken nose?
No.
Ears? Any deafness?
No.
What about their mouth? Anybody have any mouth cancer,
No.
trouble swallowing?
No.
Anybody have any? You said your dad had a stroke, right?
Yes.
Any other neurological diseases, seizures?
Yeah.
Seizure who?
Dad.
Okay. Any Parkinson's, dementia?
No.
No brain injuries?
No.
No. Any problems with the neck? Any nodules of cancer in the neck?
No.
Hmm. What about cardiovascular? Anybody had a heart attack in the family?
No.
Did your mom and dad have high blood pressure, high cholesterol, and
Yes.
your mom has a heart enlargement? But no, any palpitations or rapid beats, or it goes too slow? No pacemaker for your
No.
family? No. Respiratory, any asthma in the family?
No.
No one's coughed up blood?
No.
No cancer out of any organ system in the family, right?
No.
Musculoskeletal, anybody have problems with their bones, joints, muscles?
No.
Okay. What about the gastrointestinal? Anybody have problems with their stomach, intestines?
No.
No blood in the stools?
No.
Anybody have blood in the urine?
No.
Any urinary problems?
No.
Anybody have any bleeding disorders?
No.
Anybody have endocrine issues other than diabetes, like the thyroid, hypo or hyperthyroid?
No.
Anybody addicted to substance abuse?
No.
Anybody allergic to anything in the family?
No.
Anybody diagnosed with a medical or a psychiatric mental problem?
No.
No one has any bleeding disorders, right?
No one.
Okay, social history is about you, so we're switching back to you. So, where were you born?
Philippines.
The Philippines. Where you live now?
USA.
The USA.
Oh, sorry.
No, that's what I asked you.
Yeah.
That's what I asked you. How long have you been in the United States?
5 years.
5 years. And what is your nationality?
Filipino.
Philippine. And you're married?
Yes.
Is your spouse a male?
Yes.
So you're a heterosexual?
Yes. Straight
Yeah. Do you live in a house, an apartment?
house.
House, and who's all in the household?
Oh, my 2 kids and my husband.
Okay, no pets?
No. No pizza.
Do you smoke
No.
tobacco? Any smokeless tobacco?
No.
Any alcohol?
No.
No. Any recreational or illicit drugs?
Never.
No one in the house smokes,
No.
so no one's exposed to secondhand smoke. That's good. What do you do for fun?
Do some exercise sometimes if they have time. There's any music.
Mm-hmm.
Yeah. Walking with my kids outside.
Do you work?
No, I'm stay home mom.
Okay. Most important job in the world, taking care of the family, right?
Yeah, right?
Mhm. How's your nutritional status?
Good, thank you for the rate.
No restrictions on dietary? Any restrictions on your fluid intake, water? What do you drink?
Water and coffee in the morning.
How many cups?
Just one.
1 cup?
Yeah.
No teas?
No.
Any military background?
No.
How's your emotional stress?
Good for now.
You're not overly stressed?
No, no.
How do you sleep at night?
I sleep good. Like 5 or 6 hours
Okay.
because I have a baby.
Yeah. Waking up.
Yeah.
Do you have any history of domestic violence?
No,
No abuse?
no,
Any thoughts of suicide, past or present?
no,
Never.
no.
What's your highest level of education?
High school?
High school. Any college?
No.
No. Move on to the review of systems. So this again is pertaining to you. Do you have any problems with your eyes? Any recent vision changes?
No.
Double vision?
No.
Blurred vision?
No.
Do you wear reading glasses?
No.
Any floaters?
No.
Like cloudy areas?
No.
No. Any problems with your smell?
No.
Nose? Congestion?
No.
Discharge out of your nose? Runny?
No.
Sneezing? Overly sneezing?
No.
Ears? Any problems with your hearing?
No.
Any earaches or infections?
No.
What about your mouth? Any problems chewing your food, swallowing?
No.
No bleeding gums?
No.
Coughing up blood?
No.
Any problems with your head? Are you frequently confused?
No.
You said you have headaches.
Yep.
What about your neck? Any problems in your neck? No
No.
problem swallowing, no bulges. Do you feel like you bruise easily?
No.
Feel like you get sick often?
No.
Any cuts or scrapes that stay there longer than usual, taking a
No.
long time to heal?
No.
No bleeding disorders, right?
No.
Any chest pain?
No.
Any rapid beats or slow heartbeats?
No.
Missed beats?
No.
Palpitations?
No.
No chest pain, right?
No.
Any problems with your respiratory? Any trouble breathing? Shortness of breath?
No.
Coughing up blood?
No.
Cough at all?
No.
How about your gastrointestinal tract? Any problems going to the bathroom?
No.
Do you take laxatives
No.
to go to the bathroom, or just control it with your diet? Your blood sugar?
Just not right.
How often do you poop?
Every other day.
Every other day. And what color is it? The poop?
Like peanut butter. Just
Peanut
kidding.
butter consistency, a little pasty.
It's about normal.
Yeah, normal brown. What about urinary? Any problems with peeing?
No.
Urgency, frequency? No blood in the stool or urine, right?
No.
Good. You said your last menstrual period was 2 years ago, right?
Yeah, almost 2 years ago.
2 children, 2 live births, no abortion or miscarriage.
No.
Okay. Any problems with your skin? Any rashes or wounds? Any changes?
No.
Not sensitive to heat or cold?
No, I'm not.
No. Any unquenchable thirst?
No.
Frequent or urgent urination?
No.
Going to go ahead and go to the next part of the exam, which is the general survey of the hair, skin, and nails. The hair is black and moist, healthy, shiny, no visible bald patches. Skin is appropriate to race, no jaundice, cyanosis, no visible wounds or lesions. There is some nevi on the neck and upper chest. Um, they are symmetrical. Borders are even. Color is like a light brown. Diameter is about 2 millimeters. And how long have you had those moles nevi here?
Silver?
Are they virtually unchanged?
No,
Yeah, they haven't changed, right?
not them.
Yeah. So, yes. So if there were other vacuoles, papules, or vesicles, I would uh, investigate and assess them with the ABCDE method, which is assess for symmetry, B for border, C for color, D for diameter, and E for any evolution. Nails, mucous membranes are pink, no clubbing, no cyanosis anywhere in the mucous membranes or in the fingers or toes. And a cap refill is less than 3 seconds, which is a normal finding. Further general survey, the constitutional. How would you rate your overall health?
Good.
Good. Patient sitting upright in the clinic, relaxed posture, face is symmetrical, mood is appropriate for situation, well developed, well nourished, with good hygiene, no malodors, alert to person, place, time, situation, and no acute illness or distress. Medical assistant updated me with the patient's vital signs, which is a oral temperature, manual blood pressure, apical pulse rate, respiratory rate, oxygen saturation on room air, and you reported 0 out of 10 pain, right?
Yes, right.
Good. As well as the Snellen chart, which tested cranial nerve number 2 optic, which is intact.
Yes.
Good. You want to get him?
Huh?
You want to get him?
No, let's continue. Come here, Anna. Come here. Can you bring him here?
Okay, well, we're going to go ahead and continue on with the assessment. This is the part where I'm going to be putting my hands on you. We're going to go ahead and start with your head, okay?
Yes.
Okay, good. Yeah, perfect. I'm going to remove your headband. So, I'm going to go ahead and put my hands on you. It's okay, right?
Okay.
Any pain?
No.
You'll let me know if anywhere I touch you're having pain, okay?
Okay.
Head is normal cephalic, atraumatic, round. Hair is evenly dispersed throughout the scalp. No lesions noted on the scalp, no wounds, and it's non-tender, right?
Yeah.
Hair is healthy, shiny. Face is symmetrical. Eyebrows, nose, lips is all symmetrical from side to side. I'm gonna go ahead and assess the lymph nodes, the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental. Anterior cervical, posterior cervical, suprascapular, infrascapular, pectoral, lateral, axillary, posterior scapular, lymph nodes. No abnormalities. Let's go ahead and do some eye assessment. Going to turn off the light. This involves a bright light. I'm going to shine the light a few times in each eye, assessing your pupils. So if you would, just stare straight at me, okay?
Okay.
Pupils are equal and reactive to light in a combination. Now the next test, I'm going to ask you to follow the light with just your eyes, okay?
Okay.
Okay, good. So that's testing cranial nerve number 3, oculomotor, 4, trochlear, and 6, abducens, which is intact. She passed the cranial nerve test of the 6 views of cardinal gaze. So we're on eyes and the lights are on. I'm going to continue with the ophthalmoscope exam, which I'm going to look at the back of your eye and the retina, okay?
Okay.
This can be uncomfortable as well because it involves a bright light, but I'll be as efficient and thorough as I can. So go ahead and look straight ahead, approaching at a 15-degree angle. I have located the red reflex, moving in closer, focusing on a vessel, following it back to the disc to cup. Ratio is 1 to 3, which is normal, and I visualize the macula and foramen. You doing okay?
Yes.
Do the same with the other eye. Just look straight ahead. Look at the red reflex, focusing in on a vessel, finding the disc to cup ratio, which is 1 to 3, which is normal, and I localize the foramen and macula. Can you look at me now? And then look up, and look down. Okay, good. How was that?
Good.
Tolerating it? You still comfortable during the exam, right? Good. That is my utmost concern. I'm going to turn the light on, okay?
Okay.
Can you close your eyes? Can you smell this?
Yes.
What is it?
Alcohol.
Yeah, alcohol. So cranial nerve number 1, olfactory, is intact. Gonna move on to your ears. We're gonna do the whisper test. So go ahead and I'm gonna plug your left ear, and I'm gonna whisper. Yeah, and I'm gonna whisper something. Okay?
Okay.
You repeat it if you hear it.
Okay. I'm beautiful. No, I'm just kidding.
Good, good. And then let's do the same with the other ear. Ready?
Yes. Then.
Good. Now we're gonna do the Renee test. I'm gonna chime the hammer, place it on the back of your maxillary bone. When you hear the ringing, you tell me, and I'll move it to your ear, and you tell me when you hear the ringing, and then you'll tell me which one's louder. You ready?
Okay. Yes. I hear it. I hear it.
Which one's louder?
The second one. I hear it. I hear it.
Okay. Which one was louder?
Second one.
Okay, so Renee test passed the Renee test. The next is the Weber test. You gotta ping the hammer, place it on the center of your head. You listen if you notice the sound is equal to the left and right ear, okay? Ready?
Yes. Yes, I hear it and it's equal.
Equal? Okay, so the Weber test. So, cranial nerve number 8, vestibulocochlear, is intact. Gonna go ahead and take a look inside your inner ear. First of all, is your outer ear tender at all?
No.
No pain, right?
No.
No occlusion or discharge fluid on the external ear. Let's look inside. Tympanic membrane is pearly gray. No ulceration or obstructions noted in the ear canal. Cone of light. And no serum noted. Going to clean the otoscope to examine the other ear. Any pain when I palpate your ear on the outside?
No.
No. Inside the inner ear, localizing the tympanic membrane, which is pearly gray, which is normal. Visualize the cone of light. No obstructions or ulceration, and no serum. I'm going to clean it off again. So the nose, I'm going to plug one nostril, and you breathe out and in of the one nostril. Any problems?
No.
Is it the same? Any problems?
No.
Okay. I'm going to look inside your nose. No discharge. Mucous membranes are pink and moist. No obstructions noted on the left ear. Look on the right ear. Again, mucous membranes are pink, moist. No obstructions, no discharge. Very good. Mouth, it is symmetrical. Go ahead and smile and frown. Cranial nerve number 7, facial is intact. Open your mouth and stick out your tongue. Say ah. Uvula rises and falls. And tonsils are +1. Mucous membranes inside the mouth are pink, light pink, and moist. Top of the mouth is light pink and moist, and under the tongue, thank you, is also light pink and moist. The dentation is good with no cavities. And braces are noted. Can you feel me touching your face?
Yes.
Still doing okay through the exam, ma'am?
Yeah.
I'm going to put my hands on your jaw here. Open and close like you're going to chew a piece of gum. TMJ, cranial nerve number 5, trigeminal. Trigeminal is intact, so no TMJ, which is normal. Are you thirsty?
Hello, where is the doctor?
No idea. Thirsty, Matt?
No, thanks.
Any problem swallowing that?
No.
Cranial nerve number 9, glossopharyngeal, and 10, vagus is intact. And swallowing without difficulty. Good. Shrug your shoulders against my hands. Push your head against my arm here, and the other side against my hand. So cranial nerve number 11, spinal accessory is intact. And when you're done chewing, can you stick out your tongue and move it side to side? Cranial nerve number 12, hypoglossal is intact. All of visualizing you're swallowing in your neck. There's no tracheal deviation. I'm going to come behind you and palpate the thyroid while you swallow. No bulges. It is symmetrical. No abnormalities. Any pain when I touched your neck
No.
or upper trapeze muscles or arms?
No.
So the end. Need to check for your temporal arteries, left and right, or patent carotid arteries one at a time. Yes, right, yes. And can you turn your head that way? Check for JVD, which is negative on the right, and then turn your head to the right. Checking it from the left, which is negative from the left. No jugular venous distension. Anterior thorax assessment. It is symmetrical. Take a deep breath. The chest rise is equal to the left and right. No lesions or rashes noted on the anterior thorax. No thrills felt. No heaves or lifts. Percuss the anterior thorax. Anterior and lateral thorax. How often do you do a breast self-exam?
Sometimes a month or once.
Once a month. So you start with the inside of the nipple, right, massaging it in a circular motion outward,
Yes.
and you keep doing it up until your axillary area, and it's best done with this arm raised. So you're massaging it with your other arm, and your arm is raised so you can get into the deep axilla as well.
Okay.
Does that make sense?
Yeah.
How often do you do it?
One.
Once a month, at least.
Once a month. Once or twice a month, if I remember.
So let's go ahead and stand up, and I'm gonna face your back. The posterior thorax also is symmetrical. AP diameter is 1 to 2, which is normal. Back is good. Skin color is appropriate. Turgor is also good with no tinting. No wounds, lesions, or rashes. Go ahead and take a deep breath. And out. Okay. Thoracic expansion is equal. When I put my hands on different areas of your back, say 99.
99. 99. 99. 99. 99.
Fremitus is equal, left and right. Go ahead and take a deep breath in and hold it. Okay, let it out and breathe normal. And the next breath, blow it all out and hold it, please. Okay, diaphragmatic excursion is 4 centimeters, which is normal. Then I percuss the back, posterior thorax. No pain or tenderness here, right?
No.
Any pain there?
No.
CBA angle, tenderness negative. Gonna go ahead and listen to the posterior thorax, your lung sounds in 8 different places. When you feel the stethoscope touch your back, just take a deep breath. Good. Go ahead and face me. And the top plate for tactile fremitus on your front as well. So when I put my hands on your chest, say 99.
99. 99. 99. 99. 99.
Good. Fremitus is equal bilaterally. Gonna listen for any carotid bruits. No carotid bruits. I'm going to listen to your heart sounds first with the diaphragm. This is the aortic. Valve. Pulmonic. Erb's point. Tricuspid. Mitral valve. Now with the bell to assess any bruits. Aortic, pulmonic, Erb's point, tricuspid, and mitral. No bruits. We're going to go ahead and lay down over here.
Can I lay here, dog?
Please.
And sleep?
That's fine. Don't give me that thing. It's not a toy for you to play with.
Then I'll give it to Dada. Then I'm gonna use it.
See, it's not a toy. Now go on. We're trying to do something here. Watch your TV. Please. So I'm going to listen to your heart sounds with you lying down. That's the next step. Again, starting with the diaphragm of the stethoscope, aortic, pulmonic, Herb's point, tricuspid, and mitral. I'm going to listen to the bell of the stethoscope, aortic, pulmonic, Herb's point, tricuspid, and mitral. Positive S1 and S2, no extra heart sounds. Let me listen to your lungs anteriorly. Deep breath. Good. Deep. Deep breath. Good. Lungs are clear. No adventitious breath sounds heard. Gonna go ahead and go to the abdomen next. Abdomen is symmetrical. Contour is flat, striated. You do see the cesarean section scar. No visible masses or pulsations. Going to auscultate for the bowel sounds. Listen at 2 different areas per quadrant. Going to start with a light palpation. Tell me if anything's tender, okay?
Yes.
Then the deeper palpation. Any tenderness?
No.
No masses, bulges, pulsations noted. If you felt intense pain right here in the right lower quadrant, that would be a positive McBurney's point, signifying you might have appendicitis. Murphy sign, take a deep breath in while I palpate the right upper quadrant. Any pain or tenderness here?
No.
So that's a negative Murphy sign, which you don't have acute cholecystitis. I'll close that test. I'm going to palpate for the liver. Take another deep breath and exhale again. Liver palpated. Spleen. Just take a deep, slow deep breath and blow it out. Spleen's unpalpable, which is a normal finding of kidneys. Deep breath and blow it out. Okay. The other side. Palpate for the kidney. Okay. Now, I'm going to percuss. Percuss for liver span. Liver span is approximately 7 centimeters, which is normal. I'm going to percuss for the spleen. I'm going to percuss the 4 quadrants of the abdomen. Still no pain, right?
No.
I'm going to listen for any bruits. So assessing for the aortic bruit, renal, iliac bruits, femoral bruits, which are negative. I'm going to palpate for the femoral pulse, inguinal lymph nodes. if this is the time where I teach a male self-exam of the scrotum and testicles to once a month assess the area, notice any nodges or bulges, any pain with palpation of the testicles, and if so, to get immediate emergent help because it could be life-threatening.
What's getting done?
If there's pain in the scrotum, testicles, or if there's a mass, like the self-breast exam for women.
What you do? Bella! Go, Bobby. What? Say hi. Hi, everybody. Hi, everyone. Hi, hi, hi. Tiki, tiki, tik. Tiki, tiki, tik. La, 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 la. Tiki, tiki, tik. Tiki, tiki, tik.
Okay,
Tiki, tiki, tik.
ready to proceed with the exam, ma'am?
Yes.
We're gonna go to the upper extremities. So first of all, is there any pain on palpation of your shoulders, arms, elbows, forearms, wrists, or fingers?
No.
No inflammation, no swelling, no rashes, lesions, or wounds on the arms, and no pain, right?
No.
Gonna epitrochlear lymph nodes here in the arm, and again the axillary lymph nodes. Good. So let's go ahead and check for some reflexes here. Brachiolus is first. Keep your arm nice and relaxed if you can. I'm going to strike you here. Ready?
Okay.
Positive reflex on the right. Brachiolus on the left. Positive. Brachial deep tendon reflex on the right. And it's also positive. One on the left. Brachial reflex, deep tendon reflex is positive on the left. Triceps Relax your arm down like that. Ready?
Yep.
Yep.
Come on, baby boy.
And on the right. Just relax your arm again. Yep. See it moving. Deep tendon reflexes on the right and left tricep are intact. I'm gonna need you to stand up, please. Move you down.
Yeah.
Just follow what I do, okay?
Okay.
Shoulder flexion, shoulder extension. Shoulders abduction, shoulders adduction. Shoulders internal flexion, external. Just your shoulders,
Shoulder.
right here. Yeah, external and internal. Good. Elbows, flex, extend, supinate, pronate. Wrist, flex, extend. This is called radial deviation, ulnar deviation. Fingers, flexion, extension, adduction, abduction. Pulses, and assess your radial pulse, ulnar pulse, and brachial. All are patent. Same thing on the radial, ulnar, and brachial. I'm going to assess the tenosyne. I tap your index finger to the brachial on the medial artery. You need to pay attention if you feel any numbness in your first 3 digits. Any numbness in your thumb, index finger, or middle finger?
No.
Negative. Tenosyne on the left. We'll do the same thing on the right. Striking from the index finger all the way down to the brachial, medial artery. Any numbness?
No.
Next is the Fallon sign. Put your wrists together for 1 full minute. And after the minute, do you feel any numbness or tingling in your fingers or thumb?
No.
So it's a negative Fallon test as well. Go ahead and close your eyes, Fallon. Feel anything?
Yes.
Dull or sharp?
Dull. Dull. Dull.
What about here?
Sharp. 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 Dull. Dull.
Good. I'm going to put my hands in key areas. Bend your elbows a little bit. I'm going to pull this way. You push against it. Push down. Go. Okay? Then I'm going to push and you push against me. Up. Good. Good strength. Now the arm, elbows, I'm going to push down. You try to push up. Yeah? And then now push down. Yep. And the wrist, the same thing. Push. Good. Good strength, bilateral.
And come here.
Let me get it. Okay, next is going to be your the lower extremities. So let's go ahead and you're going to flex at the hip, your right leg. Flexion and extension, abduction, adduction. External rotation of the hip, internal rotation of the hip. Same thing with the left. Flex the hip, extend, abduct the hip, adduct the hip. External rotate the hip, internal rotate the hip. Good. Any pain with that?
No.
Any pain where I'm touching you in the knees, lower legs, ankles, toes?
No.
No. Inflammation or swelling noted. Skin is also intact with no lesions, rashes, or wounds. Turgor is good with no tingling.
Oh, okay. Dana.
Knee, if you can do it.
Okay.
Knee flexion, extension. Knee flexion, extension. Ankle, flex, extension. Internal rotation, external rotation. Flex ankle, extend ankle. Internal rotation, external rotation. Good. The toes. Flex your toes, extend your toes, abduct your toes, adduct your toes. Other foot. Flex your toes, extend your toes, abduct your toes, adduct your toes. Good. Go ahead and have a seat, please. You're going to assess for the pulses. We already assessed the femoral pulses, which are intact. Popliteal pulses, left and right, are patent. Pedal pulses. Dorsalis pedis, left and right, is intact. Posterior tibial on the right, intact. Posterior tibial on the left, also intact. Again, no pain or tenderness here, right?
No.
We're going to do some deep tendon reflexes in your patella. Okay. Strike your knee right here. Ready?
Yes.
Yes. And then the other side. Yep. Okay. Now the Achilles tendon. You just relax your leg and let me support it.
Or down your camera. Let's see.
You relax your leg, right?
Yeah.
Let me have it.
Okay.
Right? Yep. Positive. Achilles reflex on the right and on the left. Yep. Positive Achilles reflex on the left. Good. Go ahead and close your eyes again, please. You feel anything?
Yes.
Dull or sharp?
Dull. Ouch. Sharp.
Oh, sorry.
Sharp. Dull. Sharp.
Okay. Good. Go ahead and push up against my hands and then pull. Good. Strength is good. Lift your toes up. Push your toes down. Strong. Funny smell.
Funny smell.
On the sock.
Oh, there's a smell on my sock? Sorry.
Kinda.
It's new.
Go ahead and stand up, ma'am. I'm going to assess your gait. Go ahead and walk there and turn around and walk back.
Walk.
And steady gait. No loss of balance or coordination, even carrying the baby. So that's good. Spine. Lay the baby down.
I can do it.
Spine. Flex the spine. Extend the spine. Rotate the spine. Lumbar and then the thoracic. Go ahead and bend over again. I'm going to assess for any scoliosis, which is negative. And then the cervical spine, go ahead and raise your head up and look up. Look down. Tilt it to the side. And then twist your neck side to side. Full range of motion on the cervical spine.
Then.
Any pain or tenderness in the spine?
No.
No inflammation, no swelling, no tenderness.
No.
Go ahead and close your eyes. And she would put her arms ahead of her. No loss of balance of coordination, so it's a negative test, which is good. And her arms didn't deviate down, which is also good. You want it to be equal.
You're done, Dada?
No.
Oh, no. Shit. Sorry.
Your right ankle, put it to your left knee, and slide it down. Okay. Now your left ankle to your right knee, and slide it down to your shin. Good. Go ahead and lay back on there and lay down high as you can.
Lay?
Yeah.
Yeah.
I'm going to demonstrate the valgus maneuver. Any pain here?
No.
And now the varus. Any pain?
No.
Valgus. Any pain?
No.
Varus. Any pain?
No.
I'm going to bend this leg up. This is called the drawer pull test, the anterior drawer pull test. I'm going to pull forcefully on your knee. Ready?
Ready.
Pain?
No.
Posterior drawer test. I'm going to push it to you now. Okay. There was no deviation and no movement noted in the patella, which is a normal finding. Do the same thing with the other leg. This camera's going to move your guys. Anterior drawer pull test. Posterior. No deviation in the patella. Now I'm going to do the allotment test. Squeezing the knee together, putting my index finger on the patella, and it's not floating, which is normal. I'm going to do the same. The right knee, the patella's not floating, so a negative allotment test on the left and right. Okay, ma'am, I think that conducts our head-to-toe assessment. Thank you for your cooperation. Are you doing okay still?
Yep.
Thank you.
You're welcome. Thanks. Am I okay?
You're doing good. Yes.
Hi. Hi.
No, you're not going.
Say hi. Who's that? Who's that?
What's the timer on there, sweetie?
1 hour and 8 minutes.
Good. So I did it in an hour. Good. All right. Thank you, Lee. Okay.
You're welcome. You ready for your assessment, huh? Soon?
I think I'm ready to pass. Yeah.
I hope you pass.
Yeah.
Bye-bye. Say bye-bye.
I'm Matt.
Say bye-bye and good luck, Daddy. Good luck, Daddy. Say good luck, Daddy. Bella, say good luck, Daddy. Say good luck, Daddy. Good luck.
Salamat.